Good morning. My name is Tracy Trypuc. Welcome to Your Health Matters. Our discussion today will be about National Public Health Week. During National Public Health Week 2015, the public health community is rallying around a goal of making the U.S. the healthiest nation in one generation by 2030. And now, I would like to welcome my guests, Dr. Emilia Zarco, Chair of the Department of Exercise Science, Health Studies, Physical Education, and Sport Management, and Associate Professor of Health Studies at Adelphi University. Her work focuses on developing, implementing, monitoring, and evaluating health education and promotion programs. And also with us today, we have Tonya Samuel. She is a Doctor of Education and has a Master's of Science in Public Health. She is an assistant professor in Adelphi University's College of Nursing and Public Health. She is an assistant professor in the Masters of Public Health program in the Adelphi University College of Nursing and Public Health. Her work focuses on community health and health disparities. She brings field experience to teach students the realities of the new public health. Welcome both to you, ladies.
Thank you.
Thank you, Tracy.
Thank you. Dr. Zarco and Dr. Samuel, both from Adelphi University, I would like to thank you both for being here with us today. And it is nice to see you again.
Yes.
We just met on Monday night at the Adelphi University Symposium on Sports Concussions.
Yes.
That was a very great experience. There was a lot of great information, and it was also available to the public.
Yeah.
And so I support Adelphi for providing programs like that for the public, and maybe we can get a chance to talk about that later.
Thank you.
Okay. So, Dr. Zarco, you have like to promote physical activity programs. Could you give us just one program that right now that you'd like to share that has to do with Public Health Week that begins on Monday?
Yes. Our department is a collaboration of 5 programs, and all of these programs, exercise science, physical education, health, community health promotion, health education, and sport management all work together to promote physical activity. So we collaborate in the department, and we also collaborate with the College of Nursing and Public Health, our Center for Health Innovation, to implement programming that promote physical activity. Examples of this program is our adult fitness program that caters to adults at least 18 years old and above. And currently we have 200 clients. A lot of them are actually senior citizens who are having cardiovascular problems or chronic disease problems. And then we have our CHANGE program, and CHANGE stands for Comprehensive Assessment for Nutrition, Growth, and Exercise. And every summer we hold camp abilities that caters to children with disabilities, specifically visually impaired or the deaf, blind children. And all of these are to promote physical activity, because we know that lack of physical activity is actually contributory, a big contribution to our top 5 causes of death and mortality. So that's where our programs address and contributes to public health's agenda to increase lifespan.
Yes. Which is, one of the agendas that they have in trying to improve the lifespan, and that's one of the agendas for the 2030 public health program. And so now then, Dr. Tonya Samuel, I'd like to welcome you as well. And your work focuses on community health and health disparities. Can you please address some of these issues with regard to Public Health Awareness Week?
Right. And dovetailing off of what Dr. Zarco was saying in terms of getting physical activity on the agenda, which is a national agenda, we really are bringing this out in the College of nursing and public health in the new 21st century is using our available resources, literally the physical environment, looking at the macro level or the large environment and seeing how we can promote physical activity in the environment by having structural interventions and getting a new cadre of students to realize that we have to look at the big picture. And exposing and engaging individuals in passive interventions, whereby if you even just have clean streets, being out in the community, walking the community, seeing how the physical environment affects health, you might have more people coming out and engaging in the streets, walking the streets. So it also brings into perspective that public health brings in a range of different areas, even architecture, you know, community buildings, construction, you know, which isn't always parks and recreation, which really isn't thought of as, you know, a standard or typical public health way of intervening on things. So, you know, with Adelphi having a new College of Public Nursing and Public Health, with the public health school growing or a class of program growing, we are really trying to make sure that students are trained to look at the big picture.
So are you collaborating with environmental health in what you're planning on doing?
There are some students who have to take, you know, environmental health classes, so it is possibilities there to grow with other schools to make sure that students have a comprehensive global look at public health. Definitely.
You know, we have evolved truly, not only looking at our programs, but the way we design our programs now is that we include a wide range of community partnerships and involvement. And an example is our Partnerships in Health Conference, which is organized by Health Nets. Health Nets in our department is actually a network of health education professionals in schools and community health education and promotion specialists. And so every year we gather them all together to share practices, teaching strategies in schools, and effective practices, so that we know what's happening, and that enriches our curriculum and the way we train our future professionals who will be involved in public health, as well as also lending expertise, sharing expert to their work in the community. So that's happening right now.
So I'm seeing a trend, which is a very good one, of where you collaborate with interdepartmentally within the school, and you collaborate outside of the school with professionals that can help you to achieve some of these goals that you have set. And I think that that is a good way to go. I see that a lot of you know, institutions and universities are doing that. And if you'd like to elaborate on that, but I think that that is an excellent way to try to achieve goals that one has set.
And it's definitely an agenda for APHA in terms of building momentum. You know, this is a way of building momentum, building capacity for community health, population health. It's really the word.
Yes, talking about population health. Well, our recent collaboration is what we call the New York City Collaborative, organized by one of our sport-based youth development faculty. And it's a collaboration of not-for-profit organizations in New York City. And we are gathering them together to re-examine whether the way we deliver sports is really helping our children increase their physical activity. This is a big issue. We found out that there's actually a big attrition rates, and sport participation is falling so fast. So we really need to revisit and re-examine how are we organizing sports. Because, for example, if we focus a lot on winning, a lot of the children will not be interested in sports. So we are, and we know that we are competing with a lot of video games and technology that makes them just sit down. So it is now even more challenging, but at the same time exciting, because we know that if we really would like to promote health and increase lifespan, then we have to keep a balance of all of this.
Back to the environmental aspect of it, looking at the food environment, looking at the technological environment, the built environment, to get students, young people out.
Yes.
So to make it back to the way it used to be, when we didn't have all of these things to keep everyone inside, get that social capital going with young people.
Yeah.
And to what you were saying, the way they are building. I mean, before, and you can kind of get my age as I say this, but kids could go out and they could ride their bike or go for walks, and there weren't as many barriers to doing so. And then there became a lot of barriers for them to be able to participate in outdoor activities.
Right.
And especially now when they build, a lot of the buildings, homes and such, are in cul-de-sacs. And so there aren't the avenues now for them to be able to exercise and get out of the cul-de-sac. So they're not being able to exercise as much. Plus there are many other barriers to that. And so I know there's been an awareness now in urban development to try to make exercise activities for children to build to
It's
that.
a built-in. They make sure that they build in the opportunity and the way they structure.
Because we have to, and we have been addressing pediatric obesity, but we need to be able to address the infrastructure and sidewalks and all of these other things. And that's just not the only thing that we need to be addressing, because we do need to be addressing how children eat. So unfortunately, we've seen these. We've seen the public health community try to address these problems before, and yet it's still on our list of trying to reduce obesity so that we could reduce an early death, and yet it's still on the list. So that is something that we still need to try to address in more ways. And if you'd like to add to that.
Yeah, I mean, your policy development, that's a way at the macro level to make it funnel and come down. Even, on Adelphi's campus, or even around the country where we're trying to make smoke-free campuses. Once again, it's through policy, New York State policy. Coming down, the pike, we have students who, it's now going to become normalized to have a smoke-free, or, areas where people can smoke, because we don't want to, criticize or push people away, but still we want to have an environment that's conducive for everyone to have a healthy environment.
Right.
Putting in other things such as water fountains, it's public health. It's changing the environment on another level, not just about education, but this passive engagement that, it's going to be normalized after a while, that, this is a healthy environment. And so, students will also then grow and learn other techniques in our programs on how to affect change.
Yes, that is important.
But it takes effort in the beginning, and after it becomes normalized, we have another height to overcome.
10 years ago, when I started teaching here, I came from the Philippines. We were so worried that our children, and that was when obesity became a very, very big concern, and we were worried, very worried, that our children will actually have shorter lives compared to their parents. But that was 10 or 15 years ago. But now I'm seeing a lot of momentum in terms of just activities and programs and projects moving along that direction. At the same time, among our young people too. As a teacher, I have the opportunity to read, because I teach essentials for healthful living. So I have the opportunity to read a lot of this reflection. And one big project for the class is a behavior change project. And I think we are making some headway. Most of our young adults are now very conscious with regards physical activity and even healthy eating. It's as if they can cook, that's now becoming a status symbol now. Unlike before, you know, they don't even think. But if you can cook, if you can actually bring in some very interesting menu, that's now a status symbol among them. And if you're also exercising, so I think we're making headway among young adults, and we hope to continue that. And that's why I think all of the programs that we're doing in our department, for example, in collaboration with the different schools at Adelphi, is really moving toward that direction. So I am very optimistic that we are doing something and we are making headway over several of these problems.
Yes, that is terrific. Did you want to share about promoting sports level of play and how we rethink that?
Oh yeah, sure. So actually, last Friday, we last Friday we had a big gathering. About 40 sport-based youth development organizations came to our Manhattan Center. And we have Tom Ferre, who is promoting play for all, like what is your sport, and it's this really rethinking how we are going to introduce sports and physical activity. And the philosophy of this is that up to age 12, we should not be really promoting a lot of high-level sports. Children should be allowed to experiment different sports. They are just developing. And at the same time, you were there when we had the concussion symposium. Concussion right now has become a formidable barrier to sports participation. So we need to address that, not scare parents away, but actually educating our coaches, educating our schools, and policies too, because now we learned that if we actually change some rules and regulations, we can actually still promote the enjoyment and the opportunity for our children to learn life skills through sports without the threat of concussion and safety. Okay. So that's one, and so we really would like to re-examine the way we implement sports. We organize sports. We manage participation, and not so much on the emphasis on winning. Because, for example, in high school right now, they are all. I mean, the emphasis is competition to go to colleges. So sometimes, because of that emphasis, they lose the other side of it, which is really just to play.
That's what I was going to say.
Right.
Sometimes it's terminology.
To play and enjoy it, and because it's for your lifetime health.
Right. Yeah. Exactly.
Yeah. So that's some of that's some of.
It can be very complex because, you know, we do, as you said, we need to educate the parents, we need to educate the coaches. We also need to educate, you know, the universities. And I know that Winthrop is doing a very good job about that. But there are some universities where there needs to be more education because, you know, the students are out there, and sometimes they're afraid to say that, you know, I think I may have had a concussion, and then they could just go right back out there on the field. Right. So Monday night's event, you know, at Adelphi about sports concussions was a very excellent event because it provided a lot of information about, you know, if you have had a concussion, you need to come off the field, and you need to know when to return to play. Right. So, Dr. Samuel, I did want to address with you one thing where you were talking about with nursing, exemplifying public health in action through this is public health and building broader connections. Would you like to address that, please?
Yes. Taking part in the Association of Public, the Association of Schools of Public Health, or sorry, National Public Health Week. there are many initiatives going around nationwide, and This is Public Health is one to show that public health is seen in many different ways. So students are going to be wearing buttons next week while they're out engaging in the community doing health practices to show that this is actually also public health. So it shows literally how public health is exemplified in nursing.
Do you have a kickoff event planned for Monday?
We don't have a kickoff event for public health, but it's going to, run throughout the week. Just seeing buttons.
The buttons and what like acting.
I ask for buttons and ask my students to wear those buttons. This Monday we're actually going to have a table in front of our building, and it's for the International Day for Sports and Peace. And so that's public health.
You're right. Yes, it is public health. Doesn't necessarily have to be.
I have to get some of those buttons.
Yes, yes.
They're the red ones with the white writing.
Yes, and I did have how it looked, but I don't have it with me now.
So actually, it's just showing by doing.
Yes, exactly,
Yes, okay.
exactly. And they could even, be labels on, like I was saying, throughout the university, we have water fountains that have just been put up, and they have counters, so you could actually quantify the look of public health also. And you can say, this is public health. Things like that we don't really sometimes recognize. Just drinking more water is a public health.
Yeah, I use that video in my class. This is public health, and truly, it's like, for example, college students forget to drink.
Yeah, that's
so
doing so many
I have
things.
one student. So we did an assessment. Like I said, when you do behavior change, you always have to start with an assessment where you are, and she's just so surprised. They're just sometimes drinking 2 or 3 glasses of water per day. They forget, and so it becomes a project. Like I tell them, it's a very simple project, but it will affect you on your lifespan. So they're starting to, and they could really feel that if they start drinking water. So that's one public health initiative that we can, right? So I think that's nice.
We're getting close to wrap up. I just wanted to ask, do either of you have any final thoughts about Public Health Week or any initiatives?
Well, speaking on collaboration, Adelphi is in collaboration with the Long Island Health Collaborative, and it's the first collaborative that actually brings Nassau County and Suffolk County hospital organizations, nonprofit organizations, academic partners together, and on April 9th there's going to be a walk in Belmont Park.
That's nice.
So, it brings community, and also, once again, talks about the community aspect in doing and getting together. So that's going to happen on April 9th.
We have our own Nassau and Suffolk Public Health Association chapter, and I have been very much involved with that during the past 10 years. And then we kind of slowed down, and then now that there's probably something, I'll reach out to them and ask them how we could work together again. Every year we used to have a symposium on a specific topic that is of interest, and so I think it's time to bring that up again, because truly public health truly matters. You're right, and I'm so glad to be part of this and to share our programs, what we are doing, and we're open to more collaborative partnerships. And thank you so much.
Thank you. No, I think that's a wonderful idea. So keep me informed. I'd be happy to have you come back on. Well, thank you. I'd like to thank my guests, Dr. Emilia Zarco and Dr. Tonya Samuel.
Thank you.
They're both from Adelphi University, and I really appreciate having you on today. Well, thank you. I wish you both much success with these important public health initiatives that you're taking on in your communities.
Well, thank you for having us. It's really a pleasure and an honor to share our programs.
Okay. Please tune in next week for another Your Health Matters with Tracy Trypuc, RN, for another discussion of public health issues. Have a safe and healthy day.